Thanks, Rachel. Thanks for having us. My name is Preston Moore. I am a community outreach liaison for Columbus Springs Hospitals, and then Changes, which is in Pickerington in Fairfield County. And joining me, we've got Sarah Nelson and Ginger Butcher. They're also outreach reps around the greater Columbus area. And I'll let Sarah and Ginger introduce yourself. Why don't you go ahead, Sarah?
Hi, I'm Sarah Nelson. I do the same thing as Preston does. I just cover different territories. We also share the same territory at times, and we team together to bring information to the community, and people that need our help, we're out there to help them and make sure it's a smooth transition.
Cool. And how about Ginger? Ginger is one of our newest team members and is out on the east side of town, including Fairfield County. So some of y'all might run into her. Go ahead and introduce yourself, Ginger.
I'm Ginger Butcher. I've been out in the field for many years, and I'm learning today. So I'm looking forward to the call.
Good deal. So here's my intention. So Columbus Springs Hospital is a functioning 24/7 mental health and addiction hospital. And so we have some people in the community might remember Dublin Springs. That was our very first hospital up in Dublin. It's a freestanding hospital across from Dublin Methodist. And that was built and started about 9 years ago. 3 years ago, we built a second hospital called over by the airport, and we rebranded from Dublin Springs to Columbus Springs to encompass the entire Columbus market. And that is on the east side, which is where a lot of Fairfield County residents go if they need inpatient hospitalization. And then we also have a third location, which is outpatient only. It means just basically a doctor's office in Pickerington, right there in Fairfield County, called Changes. And so what I'm going to talk to you about today is a little bit about the hospital, but more importantly, I want this to be used as a community education workshop about destigmatizing mental health and addiction. And so this is my personal opinion, which my boss always loves when I share my personal opinion, but hear a lot about stigma, addiction stigma, mental health stigma, which prevents people from reaching out for help. It prevents people, they carry a certain amount of embarrassment, shame, of not feeling like they know what to do. And so, or people being discriminated against because they have some sort of mental health challenge or diagnosis. The Board of DD, I'm sure that y'all deal with that a ton, about helping clients get jobs and making sure that they have an advocate in their corner. And I argue that the way that we destigmatize is not necessarily destigmatizing drug addicts and alcoholics and high-level mental health diagnosis, but it's destigmatizing, demystifying, and normalizing basic counseling and therapy. And when I get into my talk here in a bit is 90 to 95% of our population will never need Columbus Springs level of care. They will never need to do intensive group therapy. They will never need an intensive mental health and addiction hospital. But what they would benefit from is just some basic talk therapy, some basic counseling. And I also make the argument that the more people that we have in participating in counseling, participating in support groups like NAMI and Alcoholics Anonymous, Narcotics Anonymous, grief support groups, the more people we have active and engaged in those areas, the better job we'll do at preventing our clients, our family members, our work teammates from ending up in hospitals like us. So let me get into a bit of a presentation. I'm going to do a share screen. Let me figure this out. Boom. We'll do share screen. We got that. Let me see if I can run this. Let's see if this works. Come on, baby. There we go. So this right here, our parent hospital or our parent company is called Springstone Hospitals. This is Columbus Springs East. So this is the hospital that is built over by the airport. Our Dublin hospital looks very, very similar. and it's a, like I said, a fully functioning 24/7 mental health and addiction hospital. And what that means is we have nurses and psychiatrists there around the clock. We have patients there around the clock. People can walk in the door just like an emergency room that specializes in mental health. And so what I'm going to talk about here, this is a level of care diagram that I did for Pickerington City Schools and Lancaster City Schools, but it's applicable to adults, and it's also applicable to a lot of the providers, because we work with a lot of providers in Fairfield County. So for example, when I was getting into what I was mentioning about a 24/7 mental health and addiction hospital, what that means is if someone is struggling, maybe they're suicidal, they're homicidal, they're manic, they're really, really sad that their friends, family, case managers, etc., are worried about them, and they send them to the emergency room, as they should. When someone's worried that they're going to harm themselves or others, they should be sent to the emergency room. But the emergency room is handling all sorts of things like heart attacks and car wrecks and, gunshots and things like that. So when they are evaluating what this patient needs, they're trying to determine, can we take care of that here in the ED? Can we take care? Do they need to go to a hospital, like to get something sewn up, or a surgeon, or do they need some specialized mental health help, right, and attention? Also, people that have OD'd from drugs or alcohol, people that need to be detoxed. They're drinking so much that if they stop drinking, they'll die. They'll risk their health is at risk. They won't necessarily detox them in the emergency room. They'll send them to a place like us, a mental health and addiction hospital, where they can detox safely with nurses on staff. They can be what's called stabilized with people that specialize in mental health and addiction diagnosis, etc. And that's what we do. So I talk about us being a hospital, but we specialize in mental health and addiction. So let me talk a little bit about levels of care. 90 to 95% of people will never need Columbus Springs level of care. Let me explain. Most people would never end up in an emergency room suicidal. They would never end up manic. They would never end up at such a high level of anxiety or depression that they would need to go to a hospital. The vast majority of people, our friends, our families, our coworkers, would benefit from just basic counseling and therapy. And so I think part of my argument for destigmatizing and normalizing mental health and addiction is trying to get more people comfortable with asking for help, comfortable with working on how to handle their thoughts, feelings, attitudes, and behaviors at a real basic level, because everyone has some variation of anxiety, sadness, grief, challenges as a parent, challenges in relationships, challenges at work. And oftentimes they don't think they're either bad enough to reach out for help. Maybe they're embarrassed and ashamed. And so what I'm going to try and talk to you guys in the community is, what's the difference between all these levels of care, and how can we demystify and normalize? So let's talk about this. Level 1, outpatient counseling and therapy. Now, what's interesting about the term outpatient is anything not in a hospital. In other words, someone goes to the emergency room, they come to our hospital, Columbus Springs East or Columbus Springs, Dublin, that they are in a hospital, the door is locked, they can't just come and go. That's called inpatient. When they get out of inpatient, they go to either back home to some sort of group therapy, some sort of counseling. That immediately is called outpatient. But what this level is talking about is level 1, counseling and therapy. So these are real basic explanations, and I'm doing that intentionally because I want the parents and our community members to get more comfortable with these terms. So counseling, assistance and guidance in resolving personal, social, or psychological problems and difficulties, especially by a professional. So counseling I'm not getting into all the accreditations and the letters behind people's names, but counseling is like the entry level profession, right? You don't necessarily need a 4-year degree. You don't need an extensive advanced degree. Everybody up the line can typically do counseling, but this is helping someone resolve personal, social issues, work issues. They could have some diagnosis, some mental health or addiction diagnosis, and still utilize a counselor. It's a lot of talk therapy, cognitive behavioral therapy. The very entry level of talk therapy is typically considered a counselor. Then you've got therapy. Therapy is typically done by a licensed clinical therapist. Treatment intended to relieve or heal disorder. Treatment of mental or psychological disorders by psychological means. So this is a little bit more intense. Therapists often counselors often therapize, as we'd say. I told you this was going to be non-clinical. But these are people, therapists, licensed clinicians, they can go deeper into things like trauma, childhood trauma, car wrecks, abuse, neglect, things like that, where a counselor may not have the tools and skills to get down into the deeper therapy issues, right? Case managers, case management. A lot of y'all on the call are case managers. They have a lot of case managers in the board of DD, but this is a collaborative process of assessment, planning, facilitating, care coordination, evaluation, and advocacy for options, services to meet individual and families' comprehensive health needs. So case management. Case management is an advocate, someone that's going to help you organize, plan doctor's appointments. What kind of services do you need that's provided by the county? Do you qualify for different services? Care coordination, making sure that your patient, your family member, yourself, your mother, father who are older, making sure that they're making all their appointments, etc. Often there are families and children that have a case manager that aren't necessarily in counseling or therapy and don't have a mental health or addiction diagnosis. Some case managers have counseling and therapy qualifications. There's some basic kind of talk therapy that can happen, but that's not typically their role. Social worker. Now, this is a trained personnel with the aim of alleviating the conditions of those in need of help or welfare. Now, oftentimes, at least being someone before I got into this profession, thinking of a social worker as someone that helped those in need, right? Lower income, this was my interpretation, lower income families, they needed housing help, they needed maybe food assistance, they needed some help with insurance and medical needs, etc. Now, what's a great thing about social workers is that more and more schools are hiring social workers. So they are having social workers on staff that's able to help kids and families in need. Social workers also do some variation of counseling, some variation of therapy often. You'll often run into, if you're getting an outside, doing some outside therapy, oftentimes their licensure will be a licensed social worker. It's a 4-year degree. I'm a big fan. About 80% of what I do is for our under 18 population. So I am a big fan of access to more and more social workers. Again, all these people, I guess with the exception of case management, social worker, therapy, and counselors can often counsel, but it's all variations of, they're all different, and they can do all different modalities of help. Now, something in, this is something I want to point out for our Fairfield County residents. A lot of the companies that are in your county, who we refer back and forth to, are organizations like New Horizons, Integrated Services, the Recovery Center down in Lancaster, Ohio Guidestone, Mid-Ohio Psychological, and then other private individual agencies. And the reason I like these providers and these companies is they're often virtual. In other words, particularly for kids and families, is they can actually go out to your house and meet with you. They can meet with you at a neutral location. They can meet with you in an office. It's not just a counselor or therapist, you have to go to their office. This is oftentimes when we talk about destigmatizing and normalizing is oftentimes parents and family members don't follow through getting the help because they don't have the time to take off work, drive themselves or their kids to and from. So when you have organizations that are in your community that can come out to your home or work with the family unit at home, I'm a really big fan of that. And those are all locals in Fairfield County. Level 2, outpatient therapy. Remember, I'm working up the triangle diagram that I showed you earlier. Outpatient counseling and therapy. All the same here, counseling, therapy, case management, and social work, but we're adding something. Psychiatry, which is like a psychiatrist, and a psychologist. So a psychiatrist, and this is often misunderstood. A psychiatrist is a medical professional. They have an MD, a medical degree that can diagnose and prescribe medication. A psychologist has an advanced degree in, let's say, they call it PsyD, a doctorate in psychology, or a PhD, right? Here's the difference. You could be seeing a psychiatrist that is prescribing you medication, and not be doing therapy, okay? A psychiatrist is like going to your doctor. They see you for 10, 15, 20 minutes. Maybe they spend more time with you on occasion, but they're not going to sit with you for an hour and talk through your last week or what challenges that you might be having, right? They are there specifically to make sure that your meds are good, prescribe your meds, check in. Do we need to make any evaluations? Yes, they're going to check in with you to where if you say you need some extra help, they'll make a recommendation. But just because a friend, family member, or child is seeing a psychiatrist doesn't necessarily mean they're doing weekly therapy. Also, psychiatrists often meet once a month. Now, a psychologist, that is going to be someone that really can dig into those deep trauma issues, those deep emotional issues, help you work through some of those, give you tools and skills specific to a mental health diagnosis. Now, not everybody needs a psychiatrist or a psychologist or a high-level psychotherapist. Most people might just need a basic counselor or therapist. And so what I want the community to know and understand is that there's a lot of different variations, a lot of different levels, and most won't even need this level of care. But when our friends, family, ourselves, our clients, our students, our kids are in these basic levels of care, even at the school level, the more interaction they have with providers on a counseling therapy basis, the better job we're going to do at identifying when that patient is, their behavior, their mental health challenges, their issues are increasing. And that would be up to level 2, which is still on an outpatient basis. Typically happens at an office. Possibly if it's one of these community organizations, they might go to your home, but that is level 2. Now, level 3, 4, and 5, that's where Columbus Springs falls in.
Can I interject for a second, Preston? Sorry to stop you, but
Sure.
also it's very imperative these days too, being COVID, a lot of kids, people, they're not getting out, they're not being able to socialize like they used to, and that's really taking a toll on their mental health. So it's really good just to have a baseline counselor, just someone you can go and talk to that can evaluate in case your needs do increase. So especially this day and age, I know I have young kids, and I know my 7-year-old, he has really struggled with the isolation over the summer. I mean, we tried to do little play dates, but with the fear of COVID and everything, he wasn't able to get out as often as he wanted, and with his friends as often as he needed. And I could tell it really did make a change when he started back to school, being around those kids and his friends, and just having the peer group. But a lot of kids don't have that. A lot of kids aren't being monitored. They're not being watched, or we don't know what's going on inside their home. So it is good just to be able to have that level of counseling or therapy just on a daily, weekly basis, just somebody to check in with. Right.
Absolutely. And I love that you brought that up, because I actually totally forgot about COVID. Funny that here's what's an interesting, we're in an interesting place. So number one, everybody is isolated. When we don't have those interactions before, oftentimes when someone's having a problem, a challenge, their home life, their mental health challenges are ramping up, it's typically those that catch it are either at work, their friends or family, or at school, right? When you're seeing kids on a daily basis, you're seeing your coworkers on a daily basis, that's where we identify the red flags that someone might be in trouble. Because everyone is so isolated, the high level crisis situation, which is reason for an overdose or reason for someone to come to a inpatient hospital, is up, but the referrals to our basic levels of care are down. And that's because we don't have as much interaction in person to be able to identify those red flags. The other really, I guess that would be what's going on, what we've identified. But one of the great things is previously, a lot of insurance companies wouldn't cover virtual counseling and therapy. Because of COVID, now they have to. And my fingers crossed, and I think this will be a good thing, is now that more and more insurance companies are covering basic face-to-face counseling over Zoom, that we are going to give our communities more access to this basic levels of counseling. For me, I'm extremely extroverted, if you can't tell already, but you know, this Zoom stuff isn't the same as being in person. But when we're talking about normalizing mental health, we're talking about giving more kids and families access. Having more options virtually is just an absolute godsend. So I think that's a really good thing of what's happening. The other good thing, I guess, from the industry's perspective is people know mental health and addiction is an issue. We've heard it talk about more and more and more about destigmatizing. And we're slowly, the politicians are talking about it, we're slowly inching our way into like more normalizing, shall we say, as a community. So we are moving in the right direction. It just happens to be very slow, particularly in some of these communities that don't have as much access. But those are great points for those people that might be struggling. It could be just, this is what one of my mentors says, you don't have to be sick to get well. Right? And so many people think that their marriage has to be falling apart, their kids have to be really, really struggling for them to ask for help. The earlier we ask for help, we start talking to people, we'll have more ability to prevent and identify when those around us may be struggling. So, and it's easier than ever now with Zoom. So levels 3, 4, or 5. Terms that you're going to hear when we're talking about higher levels of care. This is like that 5 to 10% of people that may need higher levels of care, like intensive group therapy. You hear things like stabilization. So someone's medication is off. You know, if someone is bipolar, they might be extremely manic or extremely depressed. They need to be stabilized or need their medication stabilized. That oftentimes is done in an inpatient setting. Observation is another one. If this is really more for kids, oftentimes when kids go to an emergency room or they'll go up to children's hospital with a behavioral health or mental health issue, they will keep them for 1 to 3 days, but they actually won't be considered inpatient. They're keeping them for observation to make sure that they're safe before they send them back home, but they're not getting they wouldn't be considered inpatient doing group therapy for a week or two. It's just observation. As far as our community knows, they went to the hospital and they kept them for a couple of days, but they are not getting that daily therapy that you might think. Inpatient. So that's what we do with our adults 18 and up. Typically an inpatient, we keep them for for about 3 to 7 days. Some people we keep a little bit longer. So that's up in that level 5. The other thing, which is often confused, is residential. Now, this is more along the lines of addiction. Addiction, if someone goes away to inpatient or goes away to residential, it's usually drug and alcohol addiction. Residential is like a 30, 60, 90-day facility where they're actually going and staying at a place. Maybe they're staying in a sober living and going to a group therapy during the day. But that is different than inpatient stabilization, which is what Columbus Springs does and other mental health and addiction hospitals. Oftentimes, if someone's struggling with drug and alcohol addiction, they come to a place like Columbus Springs for, let's say, 3 to 5 days. They detox, we get them stabilized, and then we refer them to a long-term residential drug and alcohol hospital. It's not as prevalent with mental health, but there are long-term residential places for mental health as well. Over to the right, partial hospitalization, PHP, intensive outpatient, and intensive in-home. That's at level 3 and 4. Community organizations like New Horizons, I think Ohio Guidestone might do some intensive in-home, which is about, let's say, 6 to 9 hours of inpatient therapy. Intensive outpatient is something that Columbus Springs does, which is 3 days a week group therapy. Let me see what thing is next after this. Yeah. So this is something that I think is really big on the topic of normalizing mental health and addiction. When parents, family members, spouses of, when we talk about getting ourselves help or someone close to us help, everybody seems to know about basic counseling, and they know about going to a hospital or residential, especially when it comes to drug and alcohol addiction. But those levels of care are so far apart. In other words, inpatient, residential, long-term care, they're keeping that person for 24 hours a day, right? Counseling is only usually 45 minutes to an hour a week. Oftentimes, people aren't able to go weekly, so they go they go every other week or once a month, right? A lot of people don't realize there's a lot of levels of care in between that. And I am a big fan, whether it's addiction or mental health, that the more touch, the more face-to-face, the more we can check in with someone that is struggling, the better we have over a long term. In other words, let's say someone's really struggling. They go to the hospital, they get stabilized, and then they get sent back home to their maybe chaotic environment or maybe triggering environment, or maybe they're home, maybe they don't have a home, maybe they're homeless. And then they're expected to maintain whatever's going on with work and school and family with 1 hour of counseling a week. That sounds crazy if a person is bad enough to, or severe enough to end up at that level 5 level of care. So oftentimes you'll hear people talk about step down. So they go to the hospital, they would step down into a 5-day PHP, so 5-day group therapy. Once they do that for a couple of weeks, and they'll step down to a 3-day group therapy, and then they'll step down into counseling, psychiatry, etc. Maybe they'll go from 3 to 5 day a week to they have a case manager that checks in with them. They have a social worker that does a little bit of talk therapy, and they have a counselor, right, that they're talking to. So if you add all those up, often you can get 1, 2, 3 touches a day, or sorry, a week. So it gives them a better shot of transitioning and not ending up back in the hospital. So these are all different words that you might hear that are thrown around in the clinical world that might be confusing or you might shy away from. And again, only 5 to 10% of people will need these higher levels of care, but when they do, it's imperative that we step them down in a way that's going to help them stay out of the hospital. So I'm going to do a quick overview of Columbus Springs Hospital and maybe some of the services, referrals, etc. And then hopefully we'll have some questions, and I'll open it up at the end. So Springstone is our parent organization. We're in 17 markets. One of the really great things about the Columbus market is we actually have 3 locations: 2 inpatient hospitals, one in Dublin, and one in on the east side of Columbus, outpatient center in Fairfield County over in Pickerington, which we do our group therapies for adults and kids. We also have one in Cleveland, Highland Springs, and then one in Cincinnati. So even if our hospitals are full, we can oftentimes connect them with some of our sister hospitals. I'm going to show a quick commercial. Let's see if this works. Hopefully, I'm going to play that. It'll do a little overview, something we ran when COVID started. Oops, JK. Here we go. Where'd it go? There we go.
During this difficult time, we encourage those in a mental health crisis to call Columbus Springs first to help reduce unnecessary emergency room visits. Columbus Springs provides adult inpatient services, as well as outpatient behavioral health and addiction services for adults and children. We are able to provide confidential assessments on site over the phone 24 hours a day, 7 days a week. Teletherapy is now available. If you know someone in need of behavioral health or detox treatment, call Columbus Springs first. Visit columbussprings.com.
We actually felt like celebrities. If you notice, Sarah was answering the phone as the receptionist. Erica, who's not on the call, our boss, her and I were sitting in the waiting room talking. Those that are from here actually got a couple calls, said, were you on TV recently? So anyway, that's a little bit of an overview. As you can tell that our hospitals are very nice. They're within 3 to 10 years old. And that is our inpatient facility. Outpatient, which is over in Pickerington. Now, when I refer to inpatient, outpatient, inpatient is a physical hospital. They actually go into the physical hospital and they're there 24 hours a day. Outpatient, we have an outpatient center at Dublin, which is across the street from our Dublin hospital, and then Pickerington, right? It's in the old Pediatric Associates building across from Kohl's. I think it's behind the Foot Doctor and next to the Advanced Auto Parts. So it's kind of tucked away back in there. But this is kind of what the environment looks like. This is group therapy with a master's level therapist. You're showing up typically from 9 to 3. And you're not necessarily going to be working through trauma, right? But you have a master's level therapist that's able to help you identify your thoughts, your feelings, your attitudes. How do we handle that? How do we not, get angry and, lose our temper? This is kind of what the group rooms look like. It's very intense. So when we were talking about earlier, if a hospital is 24/7, counseling is once a week, at most. Intensive outpatient is about 9 hours a week. PHP is 25 to 30 hours a week. So instead of going to school or work, they come in a room like this. They're able to be seen by a nurse practitioner. So if they're on any kind of psych meds, any kind of medication, we check in with them. We have a nurse on staff. We got a ton of help as well. But this is the kind of environment that your patients or clients would be in if they're in a outpatient or PHP situation.
Can I stop you just for a second?
Absolutely.
I have a question. Letitia sent me a question in the chat, and she has to leave to go to another meeting. But I wanted to let her ask you that before we move
Absolutely.
forward.
So I know you've gone through the tiers of kind of your pyramid there. Typically in our field, we have a lot of people that are dual diagnosis. And so a lot of times those bottom tiers are enough for someone. They go to their counseling appointments, they see a psychiatrist once a month, they do all of that stuff. And they stay pretty level. But then there are times where that's not enough and they're immediately in a crisis situation. They end up going to FMC and they try to find some place for them to go. So in that circumstance, we've had a hard time at times finding a place that will take them because of having a DD diagnosis or having autism. And so I guess, we're always trying to figure out what we can do, where they can go, who can help people that have this dual diagnosis, because it really does come down to mental health when they're in that crisis situation, and DD isn't really trained to help with that. So where do they go?
So, and let me just to get some clarification, when you're talking about dual diagnosis, you're talking about a mental health diagnosis and a disability diagnosis. Is that accurate? Or are you talking about addiction and mental health?
Definitely DD and mental health.
Gotcha. So that is a big challenge, and that is a big challenge nationwide. Okay, so this is part of the reason why people like you and your team are so important, because people with disabilities don't oftentimes have an advocate, and so that's why it's important. As far as when you go to FMC, Fairfield Medical Center, they are going to try to go to somewhere like us, Mount Carmel, River Vista, some of these places just like us. And what everybody's trying to evaluate, us included, is how severe might the issue be? I don't know if you have this experience, but what some other case managers share is sometimes, particularly in these more rural communities, is the patient is struggling with mental health, but the local hospital attributes it to their disability, and they don't actively seek out mental health hospitals, which can be a big challenge and even more reason for you to advocate for them to get help for mental health. We do take people with disability diagnosis, but we have to evaluate it on a case-by-case basis. You probably hear that quite often. And that is a good reason just to build a relationship with some of us on the call with intake staff, or give someone like me or Sarah or Ginger a heads up that, hey, I've got someone at Fairfield Medical. Here's their background. Here's their situation. We connect you with intake, so you can talk directly to them. So we're not just relying on FMC and the patient to communicate. You can actually bring that background and say, I think they could participate at the group level. Yes, they can get to and from the restroom, no problem. At what level is the, if IQ comes into play. And if they can participate, oftentimes we can take them, but we're in the same boat as everybody else. We don't always have 24/7 staff that can handle those really, really severe disability diagnosis, but we can't really figure it out until the issue comes up. And so I know that you said you have to leave, but I'll make sure that you have all of our contact information. And what helps me the most, and I have the most success with, is if the case manager, the therapist, someone that's involved gives me or us a heads up first, and we don't just rely on the emergency room and don't just rely on the parents or guardians to communicate that. You, with all that extra information, can communicate that up front, so we have a better shot at getting your patient in. But everybody is in the same boat, and everybody has that same challenge, because not everybody is able to handle those high-level disabilities. But please, please, please give us a call and heads up front, and we will talk to directors. We'll call both hospitals. We will do whatever we can to try and make sure we can get that patient in or get them to another facility. Go ahead.
And Lois, I also read that you had an issue with patients with Medicaid. We do take all forms of insurance, but those patients that have straight Medicaid or a clause in their insurance that is not allowing them in for mental health, especially in a crisis situation, we work closely with the ADAMH boards, and we try to get those patients funded. So if we're ever in a situation like that, please reach out to Preston or myself, and we will always work on that to get a patient in. That's one of the main parts of our job, is to make sure people are getting help.
Yeah, we work very closely with ADAMH as well, and we've reached out quite often for those funds, especially during COVID. I think things have been worse. So I think they're a little tapped for funding here lately.
Yeah,
Yeah.
that's true.
Makes it more difficult, but I think having your contact information would be great.
I think that's one of the main bits, is oftentimes, and I understand it, I mean, it's part of the healthcare process, and that's part of what needs to change. Oftentimes, when we talk about the healthcare system and referrals, and then we get into releases of information, often hospitals and intake departments like us are forced or expected to make a decision to take your client in or not based on paperwork, right? Based on evaluation. But if we can get you to talk directly to that inpatient manager, directly to that person that has that paperwork in hand, and you can give them the background person to person, we have a better shot at making a decision that is more beneficial for the client, as opposed to relying on a piece of paper and going, I can't talk because of releases. If we get that call before we even get the paperwork, we kind of have a knowledge and understanding. And even too, if we know we can't take the patient, we can let them know up front, so they don't get the runaround and they're not stuck sitting in the emergency room. So I'll make sure you have all that information. We'll make sure that we get you in contact with inpatient as well.
Thank you very much.
To your question and help.
Yeah, that helped a lot. Thank you.
Good deal.
Yeah, I know we're running out of time here, so we'll try to.
Gotcha. Let's see. Outpatient changes. This is where we do pediatrics and adults. So adults 18 and up. Pediatrics is ages 5 to 17. This is our Dublin facility, but this is very important, particularly for the board as well. Is we provide transportation. So for kids, typically pre-COVID time, we would pick up and drop off kids and adults. If there's we don't have as much space as we used to, but kids take priority. If they're an adult, they're 18 and up, we can do taxi or Lyft. So we do pick up and drop off transportation. So for those that have a hard time there. PHP, I talked a little bit about that, 9 to 3, 5 days a week, typically no more than 10 people in a group. That's led by a master's level therapist. Partial hospitalization is typically for those patients that they're having some sort of mental health challenge or crisis, but they're not severe enough to be an inpatient, but they need a heck of a lot more than weekly counseling. Oftentimes they'll start at partial hospitalization, which is about 30 hours of group therapy with the master's level clinician. Then when they progress a bit, get a little bit better, we'll step them down to intensive outpatient, which is 3 days a week. So they go from 25 to 30 hours to about 9 hours. Technically it's 9 to 15. And it varies from location. And we do medication management for all of our patients. So we either work with the current psychiatrist or we'll manage their medication until they're connected with the psychiatrist. Let's see. We take the adults 24/7 walk-ins. Now that's for our hospitals, not at Pickerington. So I know we're in Fairfield County, but we can't take walk-ins at Pickerington, but at Columbus Springs East and Dublin, we take 24-hour walk-ins. Oftentimes, too, it's so beneficial to catch that call up front before you make those referrals, or at the same time you're making that referral. So we're not relying on parents and guardians and clients to communicate what you know. So it's often very helpful to make that call before, whether it's for pediatrics or adults. I'll make sure you'll have all this contact information, or you can screenshot if you want to keep that.
Yeah,
Kristen, you could also email me this presentation and I can
Perfect.
email it out with all the slides.
Awesome. Let's see. This is Pickerington. If you notice, that changes Pickerington. That's that old pediatrics building. Columbus Springs East. I put those two on here because that's where most people on the east side would go. But this is all of our in-network payers. Sarah had mentioned this before. We are virtually in-network with almost all commercial insurances, all the Medicaid. So that's Buckeye, Paramount, CareSource, Molina, UHC, I think. We're in network with Medicare, TRICARE. So we cover the vast majority of patients, particularly with Medicaid. Now, it can be challenging because of the stipulations that, you would think that that would be kind of a slam dunk that a person's able to get in and get help. But depending on their insurance, sometimes they cover and sometimes they don't. But that's another example of why it's important to make those calls up front so we can game plan.
Right. And any patient that's coming in, we have to look at that anyhow, but just so you know, we can work with your insurance company too. But Preston, I'm sorry, people are running out of time here, so we got to wrap it up a little bit.
All good. Medicare, we got all that covered. And then here's all of our contact information, and you can screenshot that. We'll email it out. Let's see. I'll do a stop share. Sorry, I couldn't see any of y'all, so thanks for letting me know, sir. And as you can tell, I'm a little long-winded, but do y'all have any questions, comments, feedback that you'd like us to cover before we jump off the call? Cool. I'll make sure that Rachel gets this presentation, and like I said, most of us are very, very well connected with other providers in the area. So even if a patient doesn't need our level of care, feel free to call us and say, who works with this type of patient? Who's doing this? Who has openings? Let us know, and we'll be able to help you connect with those people. And also, if you'd like us to do any kind of presentation to your team, your case management department, or just do a collaboration, let us know. I'd love to be able to help.
Great. That's a lot of information in a small amount of time. We really appreciate all that information. And like I said, yes, you can email me your whole PowerPoint and I can send that out. So people will have that slide that has your contact info, if that will help.
It's perfect. Good deal.
Okay.